Do you wear a seatbelt when you're in the car? Have you ever received the polio vaccination? And have you ever drank water while consuming an alcoholic beverage? These are just a few examples of harm reduction strategies that you may have participated in. The National Harm Reduction Coalition in 2022 defined harm reduction as a set of practical strategies aimed at reducing negative consequences associated with a particular behavior. Today, I want to talk about harm reduction as it relates to illicit substance use and addictions treatment. Fentanyl is quickly becoming the #1 drug responsible for overdose deaths across the country and in Iowa. While our Governor Kim Reynolds claims to be concerned about these growing numbers, many life-saving harm reduction strategies are currently illegal in the state of Iowa. Today, I will be advocating for the legalization of harm reduction strategies in Iowa, strategies such as fentanyl testing strips, safe injection sites, and needle exchange programs. Throughout this presentation, I will discuss more in detail about the opioid crisis in the United States and in Iowa, how these harm reduction strategies work, and the efficacy of these interventions. Can you tell which image shows the real oxycodone pill and which image shows the counterfeit fentanyl-laced pill? If you said the bottom pill is the counterfeit pill, you would be correct. In 2022, the Centers for Disease Control released a statement saying that between the years of 2019 and 2020, the number of drug overdoses increased by 30%. In 2020, about 92,000 people died as a result of an overdose, and 75% of those people was the result of an opioid. Additionally, of those overdose deaths in 2020, 56,000 were caused by the synthetic opioid known as fentanyl. The Wisconsin Department of Health Services in 2022 said that fentanyl is 50 times stronger than heroin and 100 times stronger than morphine. The image that I'm showing you on your screen right now shows you how much of fentanyl is required for a lethal dosage. We are seeing an increasing number of fentanyl being laced other illicit substances because fentanyl has a stronger effect and is incredibly cheap to produce. For example, let's say a drug dealer is selling a gram of cocaine. It is cheaper for them to use less cocaine and put in a little bit more fentanyl and get a higher profit from using the cheaper substance than it would be to do just pure cocaine. Iowa Attorney General stated that in 2021, over 250 people died as a result of the opioid epidemic, which is a 21% increase from 2020. Additionally, they stated that first responders are administering more naloxone or Narcan than they ever have before, and it is increasing more and more. So how does harm reduction work? The National Harm Reduction Coalition stated that harm reduction incorporates a spectrum of strategies that include safer use, managed use, abstinence, meeting people who use drugs where they are at, and addressing conditions of use along with the use itself. So why is it important to meet people where they are at? Well, first, it's important to think of addiction as a disease that impacts the brain similarly to how diseases impact the human body. Addiction essentially hijacks the brain's natural production of neurotransmitters, so people can no longer get these essential chemicals from natural occurrences. Second, if you think of the phrase, you can lead a horse to water, but you cannot make him drink, you simply can't make someone quit using drugs, and they need to be ready on their own terms to quit before they can even start beginning the very long, complicated journey to recovery. A study by Hawk et al. In 2017 established 6 principles of harm reduction. First is humanism, which just means having empathy, reason, and concern for people. Second is pragmatism, which is dealing with problems practically. Third is individualism, so thinking of people with substance use problems as people with their own independent thoughts and motivations. Autonomy, meaning that people have their own free will and will continue to use if they want to. Incrementalism, which just means advocacy. And finally, accountability without termination. So people have the right to use regardless of if they're in recovery or not, and as advocates and professionals, it is important that we don't turn people away if they slip up during recovery. So I previously mentioned safe injection sites as an intervention, and Integrative Life Center in 2021 describes these sites as a safe place to use with a ready clinician who is prepared to step in case of the event of an overdose. They provide sterile supplies, secure environment, life-saving support, withdrawal management, and primary care. The Center for Disease Control defined fentanyl testing strips as small strips of paper that can detect the presence of fentanyl in all different kinds of drugs. And needle exchange programs are another form of harm prevention that I previously mentioned. These programs are simply just so that people can exchange their dirty or used needles and in turn receive clean, sterile needles. Elena Gordon in 2019 with the NPR wrote an article that discussed the opening of a safe injection site in Vancouver. Since the 2003 opening of this safe injection site, the fatal overdose rates have drastically fallen in the immediate and surrounding areas. Additionally, they found that people were more likely to decide to detox from their substance and access addictions treatment. According to the Legislative Analysis and Public Policy Association in 2021, they found that fentanyl testing strips were 96 to 100% accurate in detecting up to 10 different variations of fentanyl. The ACLU cited a study from 1997 that found needle exchange programs to reduce high-risk behaviors by up to 80%. In the same study, they also found that participants were more likely to enter addictions treatment than those that did not participate in needle exchange programs. So today I have advocated for the change concerning harm reduction legalization. In doing so, I have explained the increasing problem of the opioid epidemic in the United States and Iowa. I have provided a solution regarding the legalization of harm reduction strategies, and I've highlighted the benefits that we are seeing from other places that have adopted harm reduction strategies. If you want to take action, go to naloxoneiowa.org to find out which pharmacies near you will give you a prescription for a free Narcan injection. That is easy to use, and you do not have to know anybody with an opioid addiction problem in order to get the prescription.